it is okay if one of our goals is to protect the inheritance, but that's not our principal goal. Our principal goal is to maintain the quality of care for the longest possible time. And as you'll see for these programs, some of them, you basically have to be personally destitute to qualify for Medicaid nursing home care, for example. And if you just spend all of the family's money to get down to the point where you're qualified, then yes, Medicare is going to pay, Medicaid is going to pay for the nursing home bill. But you have no other money and no other choices. Whereas if we can arrange your affairs to have access to some other funds, we can maintain a higher level of care by paying for things that Medicaid won't pay for. An example, Medicaid gives a semi-private room. If somebody has some severe psychological conditions that they needed a private room, there's nothing in Medicaid that prevents you from contributing the extra money. So as long as we have a source of funds available, it gives us a lot more choices. I will not say categorically that some of the folks that come to me, that preservation of the inheritance is not the #1 goal. But that's not my #1 goal when I'm doing this. Okay. The Veterans Benefits is a very interesting and very helpful benefit, and along the lines of that continuum of care, it actually melds in with Medicaid in a lot of very interesting ways. And sometimes this is hard to get straight what we're actually talking about here. But for now, let's just say somebody's going into an assisted living facility, ALF, or needs some extra home health care. If they were a veteran, we can try to get them some assistance to help pay for that care. And to understand this particular benefit in an overgeneralized way, let's just view the Veterans Administration as being two different sides. There are a lot of other benefits that we're not necessarily going to talk about, but what you think about mostly is compensation for service-connected disabilities or pension, which is a needs-based program whereby the government is saying that if you fought for us during a time of war, then we are going to make sure you have a minimal level of income. And there is a base pension. There is an enhancement to that pension for housebound veterans. And then there's another enhancement to that pension for veterans who need the aid and attendance of another human being to avoid the hazards of daily living. So that's a medical situation. And for a married veteran, and there's a little fact sheet, actually I don't want to skip ahead too much. I'm going to talk about these green folders later. There's a little fact sheet in here that kind of gives you the dates of service that are required and some of these benefit numbers. But for a married veteran, the maximum pension, aid and attendance improved pension, is $19.49 a month. So that's almost $2,000 a month that we can get for a veteran if we can qualify. Another thing to keep in mind about the veterans benefits is every county in Florida has a VSO, Veterans Services Office. And these are county employees, but their job is to take care of the veterans in the county. And they do a very good job of doing that. And if you're already qualified for this benefit, we would generally tend to send you to the VSO and get them to help you do the application and whatnot. And like I said, they do a good job. But they are not going to be advocates for you in the sense of if it looks like you're unqualified, they're probably just going to tell you you're unqualified. Our job is we're going to advocate for you and see what it takes to get you qualified and arrange your affairs in a way to get you qualified. And a similarity to the Medicaid program is there's three tests of getting qualified. The service test, you have to have 90 days of service, 90 days of active duty, any one day of which was during a declared wartime period. And like I said, there's dates for this, and it's rarely we have clients who don't meet one of those dates. And you can't have a dishonorable discharge. The income test, remember I said they're going to give you a basic pension. So let's say you go in there and say, they ask you, how much income do you have? Well, I've got $2,000 of income. Sorry, you're not eligible, because the maximum pension for a married veteran is $19.49, and you're above that. The key here is income for VA purposes, which is your income less your unreimbursed medical expenses. And UMEs include a lot of things, but for example, if a doctor's saying you need to be in an assisted living facility, then the entire bill is UME. So if you have $2,000 of income and $2,500 bill at the assisted living facility, your income is now below zero, so the VA is going to get you back up to $19.49, for a married vet. It's less for a single vet, and there is a benefit for the surviving spouse of a veteran, and basically that's $1,056 a month. Then there's an asset test. And actually, in some cases, like if you're in home health, there might not be a lot of UMEs, unreimbursed medical expenses. Sometimes we can create them. Let's say that your son or daughter has to provide care services. Let's say you're paying money to a home health agency. Well, that would be pretty clearly unreimbursed medical expense, because your doctor's saying you need that. But for a son and daughter, we can create a personal care contract. And if the doctor says it's necessary that you need the aid and attendance of that other human being to help you, then we set up a monthly payment personal care contract. We pay money to the friend or relative, and that creates unreimbursed medical expenses, reduces your income. Now you qualify for the benefit to get it back up. Okay, back on the asset test. There's kind of a misnomer, there's been, not misnomer, but a false sense of security on a rule for many years, especially 3 or more years ago. You used to hear it all the time. $80,000 for a married veteran, $40,000 net worth for a single veteran. And I've even heard the VSOs putting that out lately. One of the keys, though, is that there is nothing in the law that says exactly what the limit is. It does say in the law